Good afternoon. My name is Michael Mize. I'm a student physical therapist at Campbell University. Today I'll be teaching and demonstrating the load and shift special test. The load and shift special test has been described in the textbooks and research investigations as a method to quantify or rank anterior shoulder instability and or the translation at the glenohumeral joint. This test is attractive clinically as it requires no special equipment or space. Thus, it may be utilized in multiple settings and without cost. The purpose of the load and shift test is to assess the anterior and posterior stability of the glenohumeral joint. Evidence reports that inconsistent numbers for sensitivity and specificity for the test, but the load and shift is reported to have a high sensitivity across the board. According to Kolber 2010, the load and shift test appears to be a reliable clinical test for detecting and quantifying anterior translation of the glenohumeral joint when using the grading criteria outlined in the investigation. Furthermore, shoulder translation when excessive is associated with shoulder instability. Thus, this test may prove valuable as a measurement of anterior instability. The load and shift test targets the integrity of the rotator cuff muscles, the supraspinatus, the infraspinatus, the subscapularis, and the teres minor, as well as it also targets the teres major and the articular capsule surrounding the joint. This test is most commonly performed with the patient sitting, but can also be performed with the patient supine. The patient is sitting with no back support and with the hand of the arm to be tested resting on the thigh. The patient must be relaxed so that the examiner does all of the motions required to perform the test. The therapist stands slightly behind the patient, just behind and to the side. The therapist stabilizes the scapula to the thorax with one hand and uses their opposite hand to grasp the humeral head with a thumb across the posterior glenohumeral joint line and the index finger across the anterior glenohumeral joint line. The therapist then approximates the humeral head by uploading a load and shift across the stabilized scapula in an anterior medial direction to assess anterior stability, and then in a posterior lateral direction to assess posterior instability. Be sure to always test the non-involved side first so that you have a baseline to compare the involved shoulder with. Explanation of anterior instability translation is as follows. It's graded on a scale of 1 to 3. So a normal translation of the humeral head is up to 25% across the anterior glenoid rim. A grade 1 instability of anterior translation is when the humeral head translates between 25 to 50% across the anterior glenoid rim. A grade 2 anterior instability is when the humeral head translates greater than 50% across the anterior glenoid rim, but spontaneously reduces. A grade 3 anterior instability is when the humeral head translates greater than 50% across the glenoid rim and does not reduce. Posterior translation is either normal or abnormal. Normal translation is when the humeral head translates up to 50% across the posterior glenoid rim, and then an abnormal finding is anything where the humeral head translates greater than 50% across the posterior glenoid rim. Now I'm going to perform the load and shift test. Is it okay with you if I perform this test? That's fine. How'd that feel? Felt okay? Good. Everything appears to be normal in there. Great. And that is the load and shift anterior posterior instability test.